Hello, I'm Dr. Mira Irons, President and CEO of the College of Physicians of Philadelphia. Welcome to the latest in our series, College Conversations, Medicine, Science, and Society. Today I'm speaking with Dr. Joan Gluch, a fellow of the college since 2021. Dr. Gluch is the Division Chief of Community Oral Health, Associate Dean for Academic Policies, and Professor of Clinical and Oral Health at Penn Dental Medicine. Her work includes developing and implementing community-based clinical outreach programs and dental school curricula in behavioral health sciences, community health, health promotion and disease prevention, and public health. Welcome, Dr. Gluch.
Hello. Thank you, Dr. Irons, for this opportunity.
Oh, thanks so much for joining us today. So let's just start off with routine oral health. Oral health is often one of the most neglected in health maintenance, with patients often deferring or putting off routine care until they encounter a serious issue. Can you tell us, why is oral health maintenance so important?
Oh, my heavens. Thank you. We forget sometimes how connected the mouth is to the rest of the body. I think that's happening because, we have separate dental offices, separate medical practices. We've always thought as, dentists and doctors as separate. But the idea is there's so much interconnectedness within the mouth and the body. It's really good. Oral health is integral to good total health. Any infection in the mouth can very quickly spread throughout the body, so that many times patients, and especially during pandemic, didn't we all get so busy, may not have kept up with regular activities. But it's so important to spot problems when they're early, care for them when we can in a more conservative way, rather than waiting till they are big problems, because big problems require big solutions. So yearly dental visits are great to check those problems early and solve them before they get bigger.
Great. So as a follow-up today, I know that one of the things that are recommended at a yearly dental visit are routine x-rays. And, often for people who have a very active gag reflex like myself, that's one of the things that, terrifies us at the time of our yearly visits. Can you explain a little about why those yearly x-rays are so important, and what types of things can they identify that we might not even know about?
Oh, absolutely. So, our major focus will be not only both a head and neck exam, but a clinical exam of the teeth. But often we cannot see deeply inside the teeth, so that the x rays give us that inside view, particularly as problems are developing. So, we're going to be looking at either early cavities, signs of bone loss or tissue loss around the teeth for periodontal diseases. And although we can see some clinical signs, the very specific information is through those x-rays. Now, I often like to take not only the x-rays of the individual teeth, but we have one that does the whole full face, because just last week we were consulting with a radiologist and we picked up some potential blockage of the carotid artery on a patient from our dental x-ray. So we were able to consult with a patient's physician. Surprising, lots of things can be picked up. Sinus problems, variety of ear problems, of course, the TMJ joint. And in combination with our clinical exam, the x-rays give us the best diagnostic capability.
Great. I imagine, and you alluded to this a little earlier, that many people deferred their dental care during the pandemic lockdown periods. Has the dental community seen a significant increase in dental and medical problems due to this deferred care? We hear a lot about the deferred medical care that happened during the lockdowns, but we hear relatively little about dental issues that have increased in severity.
Oh, yes, because we've been so busy with our patients, I have to tell you. We've never had such a long waiting list at Penn Dental Medicine than we have now, because, of course, patients want to get back into the regular routine. And we're seeing more serious problems. For example, we have a mobile dental vehicle. It's like a dental office on wheels called the Penn Smiles Bus that visits the Philadelphia school children. We're hearing from the faculty who staff that, as well as in a variety of our community clinics, that children have increased numbers of dental decay. It was hard during pandemic. Everybody needed to eat comfort foods. There was, potentially not as much, regular routines going on, so that people missed out on the care. What's striking too that I wanted to make sure is that we've been able to increase access to care from reopening back our dental offices, but these economic inequalities still persist. And that's an issue that when we continue to see oral health disparities, because there are limited financial options to pay for dental care. There is no dental care in traditional Medicare other than if you have some type of surgical procedure that affects your teeth. Now, there are the Medicare Advantage plans that you can purchase that have expanded dental benefits, but not for regular traditional Medicare. That's a really big focus of our advocacy, but there are so many older individuals who aren't able to get the dental care they need. And it's compounded because Medicaid has variable dental benefits, but not a lot of dental benefits among the states. Children are included as part of the Affordable Care Act. All children on Medicaid have great dental benefits, but when they turn 18, the states have very little, and that's another big part of our advocacy to look at expanding not only the services that are provided, but the fees that are provided to dentists. But, there are some states that have no dental benefits or dental benefits only for pregnant women once you pass 18. So the oral health disparities are exacerbated by these financial inequalities in treating healthcare and dental care differently. It's really crazy how our system is developed, so that many of us are focusing on universal health care coverage that would increase the dental care access available. But these already existing inequalities for those on public health insurance, those low income, have really been exacerbated during pandemic.
I can imagine, and that's even the case with private insurance. There's always a separate, you have your medical insurance, then you have your dental insurance. And, if you think about it, combining it would make it a lot easier for a lot of people. And we talk about disparities in access. And certainly, the pandemic has shown a bright light on disparities in healthcare, in medical care, with underrepresented communities being disproportionately affected. And I imagine you've seen the same thing with regards to dental care.
Oh, absolutely. So that's really been the focus of my work, because the real problem we have is if you have money, if you are of, economic status, it may be easier to get dental care than not. For example, many of our under-resourced communities have lost their private dental practices. So at Penn Dental Medicine, we've really focused on how we can integrate with healthcare centers to provide integrated care. So federally qualified health centers are a great model. They are located in, many areas, most particularly low-income areas. We've been working with Sarah Health Center, the new developing PHMC Center at Cedar, Trinity Mercy Life, Puentes de Salud. We've integrated dental care with those healthcare facilities. I mean, who doesn't love one-stop shopping? But the reality is care should be integrated. So when we can put Penn Dental faculty and students working with family physicians, the folks, all the practitioners at these community health centers, we can work together towards health. Really important for diabetic patients, for example, because we always say to patients, what happens in Vegas stays in Vegas, but what happens in the mouth goes through the rest of the body. It does not stay in the mouth. So for diabetic patients, they are really prone to periodontal diseases because of the increase in the inflammation, and these periodontal pathogen bacteria spread through the rest of the body. So we look to integrate diabetic care and oral health care to bring the best outcomes for patients, but particularly for low-income patients. Made the commitment to take every dental insurance, to look at geographic feasibility. It's much easier to walk or have a dental center in your neighborhood. And to really, rather than trying to set up all different dental offices, when you can integrate care, I think patients understand the need. It takes a village to have good dental care. And that's been the focus of our work at Penn Dental Medicine.
Wow, that's great. This co-locating care is really important. And, especially because people have to take time off of work, right? To go to the physician, to go to the dentist. And if you can do 2 appointments in one day or a 1/2 day, you're certainly ahead of the curve. I actually cared for 2 elderly parents a few years ago, who passed in their late 80s and mid 90s. And just getting them to a medical visit or a dental visit just requires coordination. It requires, a van in some cases, whether you're in a wheelchair or whatever. And, being able to do co-locating services would just be so much easier and so much better for them because they'll be seen.
Absolutely. And it's really throughout the lifespan because that's how we began our community activities at Penn Dental Medicine. I was so fortunate, started in the early 90s. My dad was a school teacher, and had risen in administration and introduced me to a lot of people. And our first big efforts were with the Philadelphia School District. We got our first dental bus in 2002. We got our second dental bus in 2019. And how wonderful the parents signed the permission forms. We park outside the school. We bring the children into the dental bus for care, send them back, send all the notes home with the families. And it's really a nice way for convenience for the family and to really ensure that children get the dental care they need. I like that with Mercy Life because they provide comprehensive day services to patients. So as they come into the facility, we have dental as well as they have all of the other health services. It's all about reducing the barriers and increasing access to care. And that's, I think, our really big imperative now to make sure we can get folks the care that we know they need.
Mm-hmm. And I think that one of the things the pandemic has taught us is that we can effectively care for patients in different ways than we cared for previously. We had a process for caring for patients in certain places, in certain ways. And I think that the pandemic required people to think outside of the box and create new systems for caring for patients. And I think that it will help in this particular case in, increasing access to services.
Absolutely. Absolutely.
At Penn Dental, you've championed the importance of including community-based service learning courses for your students. Can you tell us more about that? How the students are involved, why it's so important, and how the students have reacted to it?
Students love it. First, shout out the University of Pennsylvania has done so much work to look at community campus partnerships. Really, I was in the early 90s, I was on part of the task force that looked at the idea that the future of the University of Pennsylvania and the future of the community really were intertwined. So our president, both Judy Roden and then Amy Gutman, expanded the focus on community campus partnerships. She challenged all of the healthcare schools to develop more outreach activities because, it's not like the campus on the hill or the old model. It was Benjamin Franklin who said, really, the community and the campus are intertwined. It comes from our roots. So, number one, our students understand that and they choose Penn because they see the long-standing community campus partnerships that are through each of the schools and the campus in general. We built a wonderful movie theater and grocery store and had additional lighting. The campus security forces have been increased. And so it's been with the community. And I think it's always been in partnership. So I wanted students not only to feel that emphasis, because we've got big problems to solve as they graduate as well. So I always talk about dentists have a key role in their community. It begins in school. Each year in dental school, they rotate to our community sites. Each year they have a course that introduces them to concepts in public health, community health, prevention of dental diseases. But it's a key philosophy that our Dean Mark Wolf has really emphasized and funded so that students understand their key roles in the community setting. I mean, We've got a great flagship dental school. If you haven't been, our dental school is great right at 40th and Spruce. Every dental specialty, we think of it, we're West Philadelphia's really family dentist because you can come and get orthodontics and children can get care, implants, dentures, regular dental work. But many patients may not be able to come to us. People like care in their community. So we have set up these satellite clinics that we use the same faculty, the same policies and procedures. When you're a patient at our community site, you're a patient of Penn Dental and can come back for emergencies and come back for specialty care so that students learn their responsibilities in the community, what it's to meet their patients as people, to understand their life world. They take the bus to the community settings and see. And I think that's a real world experience that, traditionally, I mean, when I was in school, we were just at the dental school and, we're away. And it's a key philosophy of University of Pennsylvania and Penn Dental Medicine for students to understand their roles as citizens in a democratic society, to understand their commitment to our patients, our commitment to community. We take them along on our advocacy. Sure, they know about our work with, advocating for Medicare and Medicaid. And I think it gives them a very realistic perspective, that, I mean, it's one thing to be in the dental school, but when you're out in community settings, and come through the neighborhood. We hire staff from the community. It gives a different perspective. And I feel very privileged that the first dean I worked with, Ray Fonseca, brought me to Penn in the early 90s for that. He said, I want you to develop it. And the successive deans have continued it. Our current dean has really expanded it so much. But he said he came to Penn. He was attracted to Penn because he wanted to expand community activities as well and work with the students for those activities. So to me, it's all about sustainability. As I tell many of the community leaders, the students come and go, but we stay the same. We are here. And Penn Dental is committed to continue these activities. It's wonderful that the students get to work. And it's wonderful that patients get those services that we can provide. So it's kind of a key partnership where we work together with our collaborating partners.
Mhm. Yeah, it's interesting when you were talking about being in the community, really shows you a different side, a more realistic side of the patients that you're seeing. And, when I was in Boston for my 30 years, and I had 5 satellites at one point, and I would go to different community satellites. And what really struck me in some of the satellites, especially, is that people in those communities just could not come to Boston. They just couldn't come. And, the half days that I was there were always really some of my happiest clinical moments because, the patients would thank me. I liked being there, but you could really see that they were people that just had a hard time coming into the city. They just couldn't come into the city, so that they were really grateful. And I saw the world they lived in and the people that they cared for. And, we were able to connect them with, I was doing medical visits with people at the local hospitals that they could call for help. So it extended our medical network to them, but it provided them the care that they needed. And it was a different experience. It was a completely different experience from the home base where we usually care for patients.
Oh, yeah. I love that hub and spoke model because what's nice is we have the backup. For example, the very specialized procedures, root canal or, orthodontics. Patients are already patients of record. They can go back to the dental school. But for the primary dental care, we can provide it right there. You can really get the care that you need. So it's a model that I want to show students that works because they too can do this. We're training future leaders. So I know all of them will go into practice. But those who are at large community health centers and setting up additional ones, those who are leaders in their organizations, we show students a model so that they're able then to say, oh, I know about this. Yes, I'm happy to work it. The students help us sustain our activities here in West Philadelphia, but it's also creating that leadership model because University of Pennsylvania is a very international university. At the dental school, we have students from 30 different countries working with us. So I look at the global spread as well. But our students come from all 50 states, all regions of the United States. Many we hope to keep in Pennsylvania because we need a lot of dentists, but they also go and I think spreading this notion of being a community conscious dentist who understands the social determinants of health and all of the life world and context around a patient really complements their great biomedical and scientific education, their strong clinical orientation. But in community, we really look at raising their consciousness about the needs of their patients and communities.
Mhm. Right. And to your point, it allows your students to take that hub and spoke model that you've created here to where they're ultimately going to practice. And they don't have to reinvent the wheel. They've had the experience in the model that you developed to just take that and start that somewhere else so that, you can kind of seed that around the United States and internationally because it works. If you're thinking about sort of doing the most good for people to increase access. It's just wonderful doing it through your students.
Absolutely. Yeah, I know a number of people and will watch these conversations. Happy to share any additional information that we use. And I have to tell you, I was really honored to be elected as a fellow in the College of Physicians. And I look forward to continuing to work with you and everyone to increase all these activities.
Yeah, well, we're thrilled. We are thrilled on the college side too. So thank you for taking this time to speak to us about this. I always give our guests an opportunity to give any final thoughts or any final messages. So anything you'd like to say to add on today?
Uh, For those of you who are watching, think of oral health as a central part of all of your health activities. For those of you who provide care with patients, ask patients about their visits to the dentist. Recommend that they go. Really think of oral health as part of the whole evaluation you do and all of the recommendations that you do with your patients. It's integral. So integrate oral health within your activities and we're happy to provide more information if you'd like that.
Great. Well, Dr. Gluch, thank you so much for taking the time to talk today. And thanks to all of you for listening. We'll be back again with another episode of College Conversations, Medicine, Science, and Society soon. Thank you.